Thank you all for being here. My name is Michael Gardiner. I come from Providence. I was born in Cranston. Went to LaSalle, Cranston East, University of Rhode Island. Graduated from Western New England College School of Law in 1989. Passed the bar on the first attempt. I'm glad to say I've been practicing law in Rhode Island and Massachusetts for about 19, 20 years now. Doing civil litigation, criminal trials. I've had criminal trials in state court, federal court. I've had civil trials in the state court. I've been working, representing individual clients, companies, and even municipal agencies and municipalities during those 20 years. And so I've had a lot of interaction with the law in general and with federal law as well. And the duty of a representative is to protect and to serve the people. And what the people want is peace. They don't want to be worried about their government. It's illegal to worry a horse in Rhode Island. And it seems to me that this administration in Washington has been worrying us for a year. You know, health care reform has been on the table. Our insurance rates are going through the roof, and we've got no relief. We need a market reform. We have 2 or 3 companies dominating the state of Rhode Island, effectively no competition, and our rates are going through the roof. But we can't get any market reform because Barack Obama says, and Lieutenant Governor Elizabeth Roberts says, that we can't have any market reform unless you agree to a new system of subsidy and entitlements and expanded government. And you, the earners and payers for health insurance, are entitled to reform without any conditions, period. I'm running, thank you. Jobs is going to be a big issue. As Republicans, we can't just say no. The people out there, they want to know what we're going to do about jobs. Now, the first stimulus package just was a government-to-government stimulus. It helped government and the friends of government. But it didn't really help everyone else who wasn't a teacher or a policeman or a construction worker or a government employee. What about the rest of us? You know, there's a lot of foreclosures coming down the pike. We really probably should do something to make the lenders want to work out the loans with us. So they're actually calling us and knocking on our doors to say, what can we do to work out your loan? Let's give them a tax credit. So they'll call us and say, we're not going to make you apply, we're not going to make you pay, we're not going to give you any phony promises, we're cutting the interest rate on your loan, we're cutting the payments for a period of 5 years. Let's just do it right and stop the foreclosures, because we can't have the foreclosures eroding our tax base. We have to give people fundamental help right now. As far as jobs, health care reform is kind of a 2-for-1, because $4,800 is spent annually by an individual on their health insurance. It's about $13,200 for a family plan. If we could get a nationwide market going, a 10% cut would cut more money, would create more savings than the stimulus checks we received in 2007. Thank you. Well, thank you, John. Oh, well, you know, what it really is, the stimulus seems to be a time-release pork package timed to support the re-election bid of Barack Obama and his party. A lot of the money hasn't even been released. So it really has been a self-serving package, and it's really just picked winners and losers like they always do, and given jobs to friends of government. Everybody else has been left aside. As far as I am changing the language of health care reform, I've been calling for a nationwide marketplace in health insurance using a uniform state law process like the Uniform Commercial Code. The states have within their power the ability to create a nationwide marketplace in health care. The states need to get together like they did with the Uniform Commercial Code and simply say that this is a sufficient policy of health insurance. No state shall require more. These are sufficient consumer protections. No state shall require more. We did this in the 1950s and created a unified nationwide economy that was the envy of Europe and inspired the European Common Market. We need to get this market reform done. But at the federal level, Barack Obama says, I'm open to ideas on health reform as long as you insure 46 million Americans who don't have health insurance. What he's saying is there will be no reform of health insurance markets at all. What there will be is another subsidy and entitlement program, another top-heavy government intrusive effort to control your lives and to tax you, tax and spend, making your health care a political football. At the state level, Elizabeth Roberts loves the Healthy Rhode Island plan. It's the same thing. Market reform is, well, maybe the health insurance commissioner will talk to the New England states, the health insurance commissioner of the New England states, and they'll agree on some reforms. But before that ever happens, there'll be compulsory coverage and a new, a group of payers and subsidized. And the people already paying too much will have to pay for the subsidized. I happened to serve at Fort Hood briefly. I was an artillery officer, and I actually did a tour there as a young officer candidate, I believe. And probably there was some inhibition, some desire to maybe cut some slack and maybe some poor judgment in overlooking this gentleman who, as Mark said, was going off the reservation, was manifesting objectively that he had some hostility to his to this country and to his service, and they should have picked up on it. They were inhibited. But I don't want to criticize, the role of our military in the social experimentation role. I mean, our military actually did so much to integrate this society. Our military is a place of great courage. We had, from the revolution, we had black soldiers fighting alongside us. We had in the Civil War too, and many times we treated them very poorly. And we integrated our military in the Second World War, and we had great heroes like the Tuskegee Airmen. And so we have used the military as a place of great courage to make changes in our society, and those changes have been important. Congress approves, commissions officers. I don't know how this man got through the process. People are interviewed. Clearances are given. They talk to people and they ask questions. This man got through the cracks. His neighbors must have said he's an okay guy. People who knew him must have said he's an okay guy. I would just view it probably an isolated incident. I also trained with officers from other countries at Fort Sill. And I have to admit, I was training with, officers from Middle Eastern countries who didn't often say things that were very friendly about our country, and I had my doubts. But that's part of the reality of our alliance system, is that we work in close cooperation with people from many countries, many allies, and, hopefully there's some benefit from that too. Medicare is right now about 16% of the federal budget, and the baby boomers haven't hit it yet. So there's a major problem. Right now, the current plan the Republicans have put forth, I think, makes sense. Other economists have said makes sense. If you're under 55, we're going to have to raise the age limit for you. If you're under 55, we're going to have to raise the age limit substantially to something like 75, 77, in order for people to collect Social Security. It's just the way it is, as you're saying. Privatization, as Mark suggested, is part of the solution, but as he also suggested, is that politically very difficult to do. We're more likely to succeed initially in getting people under 55 to be eligible at a higher age. I think we also need to be looking forward to incentives. We need medical savings accounts. Healthcare relates to a lot of this. We have to get a nationwide market, get rid of the state lines, make health insurance more affordable. We have to have all people having medical savings accounts so that they can start saving young. So not only will they have money for their medical bills and for higher deductible policies that will cut their costs later in life, but they'll also have the money for their nursing home care when they get older. So medical savings accounts have to be done. But again, as I said before, a lot of these reforms have been obstructed and held hostage by the Democrats. They don't want it. They don't want vouchers in Washington, D.C. because they might work. If they're successful, then they have to compete with a successful idea. They don't want to compete with a successful idea. They don't want. This has been the story of the last 20 years, the last 15 years. This is why I'm running. I'm so frustrated with, listening to the same debates over 15, 20 years. We can't get anything done.